We're going to talk about vitamin D, why we need it, how do we get it, how do we test for it, what happens if we've not got enough, and what happens if we've got too much. So what is vitamin D and what does it do? Well, vitamin D is a nutrient that we all need. It's a steroid. So vitamin D helps in many ways. It helps with the way that bones work, the way that the little cells, the osteoclasts, the osteoblasts work. That's the bone forming cells. Our bone is alive. It's not like wood. It's working all the time. And in fact, our whole skeleton is replaced around about every 7 years. And we have these tiny little bone cells that sort of create and also munch away our bones and reform it. And the vitamin D helps those little cells do their job, their function. It works with our muscles, it works with our nerves, and it works with our immune system. So it's a really important vitamin for us in terms of our overall general health. So how do we get our vitamin D? Well, one of the big sources of vitamin D is actually sunlight, our exposure of our skin to the sun. And what that does is that exposure to sunlight causes a reaction, and then we're able to produce vitamin D from that. However, depending on where you live, can depend on the amount of sunlight that you have. So you don't need a huge amount of sunlight. Small exposures on a constant basis help. But obviously during the winter months, where depending on, again, where you live in the world, our exposure to sunlight might be limited, and therefore our levels of vitamin D could potentially fall below that of what we need. Other sources are from diet, such as fatty fish, salmon, mackerel. Sometimes we might find that it's actually been added to milk, what we call fortified. It can be in some breakfast cereals. So a lot of animal products therefore contain vitamin D, which means that if our diet is primary vegetarian or even vegan diet, then we might need to sort of supplement that with vitamin D supplementation. So how do we know if we're deficient in vitamin D? Well, the most accurate way is through a blood test. Now, there are testing kits that you can do yourself at home. You order the kit, you then provide small little blood sample, usually a finger prick test, and I'll demonstrate that in a little bit. That gets sent off to the laboratory, and they will then provide you with the results and let you know fairly accurately what your levels are. The other way is to ask your medical practitioner to take a blood test, and it'll probably go to the similar sort of lab, and then the results will come back, and then the medical practitioner can go through that with you. If you are doing your sort of home kit online without the assistance of a medical practitioner, it's probably important to discuss the results if they are slightly low or very high with a medical practitioner. So it's important that you get that advice. When it comes to implants, there is some evidence that would suggest that a lack of vitamin D can actually have a negative impact on the implant success. And this goes hand in hand with our kind of understanding of how vitamin D works with the bones. So if you are considering having some type of implant therapy, if you don't already know it, it might be wise to get your vitamin D tested, and your implantologist may suggest that. Um, you may choose to go and get the home kit done, and then that will give you an idea of where your vitamin D levels are, and then get some advice. Once you've done that, if your vitamin D levels are outside of the normal range, if they are low, before you go straight into supplementation, discuss that with a medical practitioner, find out the reasons why you may be low, and then if you do need the supplements, then you can get the correct supplements so you're not taking too much vitamin D. Once again, I'd get tested again if you are considering those implants once you've started taking supplementation, if that's the right thing for you to do. And then once you're within within those normal ranges, then what that would ideally do is improve your success rate for dental implants. So how do you test for it at home? Well, there are various kits. The one I'm demonstrating is by Better You, and it's a simple finger prick test. You then wrap that all up, send it off in the post. This is a UK-based kit. And then there is a laboratory in Samwell and Dudley and they're affiliated with Better You. So it's an NHS laboratory that will do the private test for you. They will then email you back the results, and they will tell you where you are in terms of your vitamin D levels very accurately. And then from that, you can decide whether you need to seek further advice and whether you need to think about supplementation or not for your vitamin D levels. If you found it useful, click subscribe. Always helps us out. Just press that button. Helps us grow the channel, provide more content like this. Enjoy the sunshine. So it comes in a little cardboard box. It's little certification. And there is also a little pamphlet, well, big pamphlet actually, by Better You, telling you that they partner with Sandwell and West Birmingham NHS Trust. Obviously, if you're in the UK. And here we go. So this is the leaflet. If we open it up, it's fairly straightforward. You fill in your details, and then you can see the steps here. So step 1, 2, 3, where you're basically opening up the lancet, giving a little finger prick. You've got some little alcohol wipes just to make sure. Then you give it a little squeeze, just being careful not to squeeze the end of the fingertip, getting a little blood spot, and then you provide those 4 blood spots on the test itself, on like a piece of card, and then you pop that into the post, and then off to Sandwell it goes, and then you get your results coming back, and you can see severely deficient, deficiency, insufficient, and adequate, and that's what you'll get back from this little test. Here's the little kit itself in here. Just got a bag that'll post everything in. Little blood spot card where we're going to 2 little lancets just in case we can't quite get enough blood off the first one. And then obviously a nice little plaster. All goes back into the box, wrap it up, post it off. It can take about 10 days to get the results, and when you do, they come in a little PDF file which is password protected, so your data is safe. As you can see from this example, it gives you that sort of traffic light indicator as to whether your levels are too low, in the normal range, or above the normal range, and you actually get a very accurate reading of what your levels are. So from this, you can inform your implantologist, or you can get recommendations from your pharmacist, your GP, or your healthcare provider, which should hopefully give you some idea of where you are in terms of your vitamin D health. Again, hope you found it useful. Thank you for your time.